This week is Black Maternal Health Week.
So we're going to talk to a doctor about the disparities in healthcare, that some organizations, what they're doing, and how you can help out as well.
All right, so the White House has issued a proclamation, its first ever, for Black Maternal Health Week. Yesterday, Vice President Kamala Harris hosted a roundtable discussion on this topic, focusing on the disparities that Black women face in maternal health in this country.
So here to discuss some of the disparities is Dr. Rahul Gupta. He is the Chief Medical and Health Officer at March of Dimes, one of the organizations that supports Black Maternal Health Week. Doctor, good to have you with us.
Thank you for having me this morning.
Do we know why the disparity exists?
Well, we look at it as really a symbol of what's happening in our communities. You know, the pandemic has really unveiled the underlying tremendous amount of challenges for Black and brown populations across our nation, and these disparities are no different. So whether it's the ability to have access to good health care, the ability to make sure that you have the ability to get there in terms of transportation, housing, food insecurity. There are so many things that happen when we talk about the underserved population, when we talk about communities of color. It's not just limited to one thing. It impacts all across the board, and maternal and infant health is one that we should definitely not be allowing to happen, but they exist.
What specifically is the March of Dimes doing?
Well, you know, not only have we've been engaged in this, but we've been engaged in this for many, many years. So one of the things that we're doing is what we call March for Babies. March for Babies is the March of Dimes' largest fundraiser that is happening year-round in communities in the greater New York and New Jersey region, as well as throughout the United States. What we do basically with that is we're lifting up communities for health equity. We're opening the door for all moms to have access to care. We're attracting attention to the issue of preterm birth, as well as maternal and infant health. It's important for us because we help not only the research field to get the most cross-cutting research out there that helps save lives, but we also then work on moving to fight the challenges, and ultimately we envision a place where we have entirely no preventable infant deaths, no preventable preterm birth, as well as maternal poor outcomes. So working through programs and policies and research to ensure that every mom and baby have the best chance of survival across the country. And we cannot do it without looking at it through the lens of equity.
So, you know, we've been talking about this certainly the past year about equity in health. It is 2021. This is America. How is this still going on? You said that your organization has been, you know, trying to change things for the last, you know, couple of years, decades. How is this still going on in our country?
The fact of the matter is the structural and institutional racism is no different in healthcare than it is in everywhere else. And Institute of Medicine set that in 2002. What does that mean for moms and families out there? What that means is if you're a Black woman, you're 3 times at least more likely to die as a result of childbirth as opposed to a white woman. You're also more likely, especially in families in New York and New Jersey, 50% more likely to give birth to a preterm baby. Now, that's not right and that's not fair. So what we think needs to happen is much more effort to fight institutional racism. We have developed trainings called implicit bias trainings. We're working with our federal and state partners to advocate for good care, good access to care, and really take an approach that is anti-racist in nature. It is unacceptable, as you mentioned, today in 2021, to have, of all things, race dictate your outcome. But unfortunately, whether it's the pandemic or maternal infant health, race does dictate the outcome for many, many families.
So, Doctor, I know the March of Dimes usually does a great big march in our area, but it's going to be done virtually. And I believe it's Sunday, April 25th at 10 a.m. How can we participate?
Absolutely, you're right. That March for the second year now is going to be virtually. We really invite you to sign up for March for Babies at marchforbabies.org. That's marchforbabies.org, which you can help us by signing up today for this virtual celebration to be held on April 25th. You can also then from there go, you could download the app from the March of Dimes Charity Cloud app, and then go up to the Step Up Challenge. It's a Step Up Challenge that allows you could help our organization reach 500 million steps in honor of the nearly 500,000 babies that are born preterm or with birth defects each year. So you can do your part in making sure that we are fighting this good fight to help eliminate all the preventable infant deaths that are happening, prematurity, as well as maternal deaths.
Thank you so much, Doctor. We appreciate you coming on.
Yeah. Thank you so
Thank
much.
you.
Good luck.